It's such an honor to be part of a group of such esteemed speakers. I'm also from USD, batch 2010, go USD. But it's okay, if we lose, a typical person from USD would just pick himself up and move forward, right? We've been in the finals so many times that we've lost, but it's okay. Okay, so I'm gonna be talking about telehealth. Now, just to show a raise of hands, how many people here have a friend who's a doctor? Friend who's a doctor, okay, great. How many people here consult that friend in times of need or when you're sick? No one? Through text, right? How about at 3 a.m. in the morning? Sometimes, right? Some of us, we can, but for most of us, we cannot. And that's what I'm here to talk about. I'm going to talk about telehealth. Okay? So what is telehealth? Based on World Health Organization, it involves the use of technology or telecommunications and virtual technology to deliver healthcare outside of traditional healthcare facilities. So what does that mean? That means that as easy it is for you to purchase an item online during 11/11, it would be just as easy for you to consult a doctor using your mobile phone. Who here purchased something from 11/11? No one, okay, perfect. Okay, that's how it is. Meaning that you don't have to go to a doctor or travel to a doctor, travel to a clinic, travel to a hospital just to consult a doctor because of your current condition. This is what we call the triage pyramid. So the triage pyramid defines the typical patient journey when someone gets sick. So when you get sick, you'd probably go to a hospital or consult your doctor for primary care, right? That doctor will tell you to get some tests done and to find out if you need to consult a specialist doctor or if you need to be admitted to a hospital. Eventually, if your symptoms persist and you don't get well, you might have to take maintenance medicines. And this is for the long term. This is very expensive. So as you go up the pyramid, in the triage pyramid, costs rise for yourself, for your family, even for the HMO that you might be tied up to. But by introducing telehealth at the bottom of the pyramid, what it does is it helps you save money. It helps prevent you from having to go through the next 3 phases of the pyramid. You might be asking, how can telehealth help? But usually 80% of the cases through telehealth can be solved and treated through telehealth. These can be your regular cough, colds, you can have abrasions, dermatological cases, back pains. So based on global studies, 80% can be treated through telehealth. So how about the Philippines? These are the areas or countries around the world that have telehealth right now. So as you can see, it doesn't discriminate. It can be from North America, South America, developing countries, developed countries, it doesn't really matter. So all it takes is for people to know about it, for it to thrive. So why not the Philippines? Let's look at some statistics first regarding our healthcare situation and our landscape. There's around 108 million Filipinos right now. 1 doctor for every 33,000 people. So you can imagine all the doctors lined up. Let's say there's an epidemic, all doctors lined up. Each doctor will have 33,000 people lined up just to be attended to. 1,800 hospitals, and 5 beds for every 10,000 people. This is a reality. As you can see, there's a lack of infrastructure, a lack of medical professionals. You go to the different hospitals, not just in the rural areas, even the city, government hospitals. You have 3 people on a single bed sometimes. They're sharing the infrastructure because there's a lack of it. However, the good thing is we're catching up, right? The Insurance Commission has been very good in terms of educating us about the importance of insurance, and 48 million Filipinos are insured right now. Going back to the bad side, there's an average of 3 hours waiting time when you're at a clinic. I personally had to go through this. Who here has waited at a clinic or a hospital for more than an hour? That's all of us, right? And sometimes it's inevitable. Not just because, for me, I'm going to give you a personal case. My wife and I, we had to wait around 4 hours, and we were only 3rd in line because the doctor had an emergency at the previous hospital that she was attending to. But that's okay. I mean, it's not her fault. It's not the doctor's fault. It's just that there's a lack of physicians and lack of doctors or medical professionals in the Philippines. Another case was that we were 60th in line, that's 6-0, I'm not going to say the specialty because the doctor might watch this. And okay, so we were 60th in line and we had to wait 4 hours. So it's really a problem for Filipinos to have to visit a doctor. which leads to around 57% unattended deaths. So the lack of infrastructure that you see, and all the statistics that I'm showing you right now, is a contributor to 57% unattended deaths. They know they're sick, they know there's a problem, but they cannot consult a doctor, or they choose not to because it might be too expensive. Going to an ER would automatically, once the door opens, you have to pay automatic 1,000 pesos, for example. Miscellaneous costs, doctor's fee, the IVs that you have to pay for, automatic around 1,500 to 2,500 pesos. You might be too busy. I think we're all kind of workaholics here. That's why I want to be able to have work-life balance. We're too busy to go out to a doctor. If we feel sick, kaya naman, I can wait until the weekend before I consult a doctor. I'll just sleep it off, right? Heavy traffic. Worst city in the world for traffic, Manila. QC to QC, 3 hours, right? I used to live in the Scout area along near Tomas Morato, and we were supposed to go to East Avenue Medical Hospital. It's literally less than a kilometer away, right? It took us 2 hours to get there on a Saturday, horrendous traffic, right? You might live in an isolated location. You might not have any nearby clinics or hospitals. Long lines at the clinics and hospitals, and this is number one. The reason why most Filipinos don't get the proper medical advice that they need is because we self-diagnose. We get sick, we go to Google, I have a headache, what's the diagnosis? I have cancer, right? And then eventually you take the wrong medicines, and the wrong medicines that you take exacerbate your current condition. Surprisingly, 50% of Filipinos still worry about their health. And I think you'd all agree with me that we all long to have a healthy family, right? We all long to have a peace of mind if we're outside and our kids are at home. And we long to have a long and happy life. So we want to be able to grow old with our kids, eventually meet our grandkids. I for sure do. I have a son who's 4 months old, and love to be able to have a work-life balance now and get myself healthy, go back to the gym. So I'd also want to keep myself healthy. How does telehealth help in general? Immediate access to nurses and doctors. That means you don't have to travel, like I mentioned, to a hospital or a clinic. Medical assistance anytime, anywhere. 3 a.m. in the morning, call a doctor. Less travel time and expense. You don't have to worry about the traffic, the horrendous traffic in Manila, or let alone other key cities in the Philippines. Reduce exposure to other patients who may have illnesses. So some of us might be hypochondriacs. Any hypochondriacs here who worry about sicknesses? Yes, some people do. They don't want to go to a hospital because of the airborne sicknesses that might be around, right? Less missed time at work. We might not have enough SLs or sick leaves to find a leave to go to the hospital. And easier management of ongoing conditions. You might have a current sickness or illness that you want to consult a doctor with, and get some tests read. Telehealth can help through that. So what is our solution? So we wanted to come up with a solution that will address this problem. The problem is really the landscape of the Philippines in terms of healthcare is a complicated and tedious one. Our solution is a hassle-free and comprehensive telehealthcare process, quick access to a doctor, and affordable family-friendly plans. So that is Kitika, that's our company, your complete telehealthcare solution. We provide 24/7 service, unlimited consultations. So be it 3 a.m. in the morning. Some cases we receive calls that are 4 a.m. Doesn't matter. Our doctors still attend to them immediately. Going back to that. Unlimited consultations. The whole subscriptions for the whole year, for example. Doesn't matter how many times you get sick, you can consult a doctor. We provide e-prescriptions and medical certificates. E-prescriptions for the lab requests or medicines. And partner specialists. So globally, telehealth lacks physical examination. And the thing is, what we do is we refer you to our partner specialists in case there's a need to do so. So our platform allows you to chat with a doctor, call, or create a callback request, which allows you to have a video call with our doctor. Now, in case you don't have load, you have no credits, for example, you can create a callback request. We will be the one to shoulder the cost for the call and call you back. The patient also has access to his own electronic medical record or dashboard wherein he can go back to his consultations. For every consultation that he has through Kitika, it'll be saved here through cloud, which will also be saved to the mobile application that we have. Can you please play the video?
Feeling under the weather? Don't want the hassle going all the way to the hospital just to wait in line? Don't worry, we've got you. Kitika is your complete telehealthcare solution that makes consultations so much more convenient and affordable. Now, you can talk to a doctor in just 3 easy steps. Sign up, subscribe, and consult. It's that easy. Try it yourself.
That's Kitika. Kitika allows you to consult a doctor anytime, anywhere. We solved the problem of a tedious and complicated healthcare landscape in the Philippines. Although the infrastructure side, that's something that we cannot solve. What we can solve is the immediate access to a medical professional. So our goal is for every family in the Philippines to be able to consult a doctor whenever and wherever. So we're living in a technological age right now, and we're blessed to be in this age, in this era, wherein we can have food delivered in our households, purchase products online. E-commerce platforms are out there, unfortunately killing some of the retail stores. In America, and recently, one of the, I think the largest e-commerce platform, Amazon, they created their own telehealth app also for their employees. They see the need for this. They see the need for all their employees, all their members, all the dependents of their employees to have access to a doctor whenever they need it. And that is our goal. So can you imagine a day where healthcare is no longer considered a luxury, but rather going back to it as a necessity?